Night duty with a lot of rain. So I'm doing random questions. Night duty with a lot of rain, doing random questions. So if someone has a query, that person can ask any question that you feel like you really need to ask. It is an open session and anyone can ask any question. That's why I'm live. Night shift with heavy rain and random questions. Night shift with heavy rain and random questions. Hmm? If anyone has a good question, a question that we can all of us share, anyone can come and talk about it, and we see how we can do things here. Random questions. Medicine is vast, and people may have needs, people have issues they want to, to, to talk about, people have many things that they want to know about their bodies. But do you think that medicine is all about uh, medicine is all about being taking medicine, and when you are sick you want to no, medicine is not all about taking medicine. Medicine and health are two different things. Medicine and health are two different things. And you will find that there are so many branches of medicine. You know, people think going to a hospital only entails going to see a doctor because someone is sick. No, that is a very bad notion. When a person is sick, you go to hospital. And sickness does not entail body weakness only. We will tell and we will talk about what people suffer from that they think it is not medical. You see, some things when people suffer from them, they don't know it. Some things are medical up until these things start affecting them physically. Because if something does not affect you physically, you will not know that this person is sick. You see, it is of help when you you feel some issues. You know, let me talk about branches of medicine. Medicine has so many branches. Medicine has so many branches. Let me check out this one. Let me check out this thing here. Some things we at times when you are sharing some important information, it's good you tell your friend. You see, good you tell them, hey, there is good information going on here. Let me share this first before we continue. Let me share this first before we continue. Let me share this first. We want to know everything. And if someone comes in the platform and this person wants to know, this person wants to know what is going on, this person can. This is, let me see this one. Hmm. People think going to hospital is only when you are sick and your body needs to be checked what is going on. You know, out here people suffer a lot of things, eh? A lot of issues, mental issues. People suffer a lot of issues that at times, let me see this group here. just need to add here and then another one, some groups. Okay. Yes, we continue. Uh, People think that going to a hospital only entails you when you are sick and your body is very sick and you cannot move, or there is a function that is not only okay that can, you see, you 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 will only know that you are sick when some things happen to you, when some things happen to you like headaches and body malaise. I mean, when your body is weak and you feel that your body is not okay, that's when you want to go to a hospital. It's a session for random questions, but we need to understand how and how medical practices are. It's not only people that are sick, although when you're sick, you have to go to hospital. But you see, here it says, health and medical consultations involve different branches of specialties, where doctors or health professionals focus on a specific body part, disease, uh, and groups. Here are major branches that I want to go through, that every person can know how to go about when you are sick. Internal medicine. These are the branches of medicine. Internal medicine. It deals with diagnosis and treatment of adult diseases. With diagnosis, when you are sick and you feel you're not okay, this is a branch of medicine. When you go there, they do lab works, they do some tests, they do this and there, and then you feel you are okay. Includes condition like diabetes. You see, for you to be found out that you have diabetes, hypertension, infections, and heart diseases. You know, there are so many heart diseases. And sometimes when I see people are hypertensive. Hypertensive disorders are so many, and they are brought by several factors of humankind. So internal medicine deals with this specialty. When you go there and they do diagnosis and they find that you have a problem, and this problem can be sorted out in this way. That is a branch of medicine that deals with it. And then we have something called uh, pediatrics. Pediatrics, when you hear peds, that one we talk about, we are talking about children. We're talking about children. Children focuses on health care of infants, children, and adolescents. Focuses on healthcare of infants and adolescents. You see, so when children are sick, they are taken to a pediatrician. A pediatrician, it focuses on children. Children, and at times children that are under 5 years. When children are under 5 years, please don't take them to a pharmacy over the counter medication. Take these children to a specialist, a person who knows what he or she is doing. You get it? A person who knows what he or she is doing. And then we have something else called obstetric and gynecology. Obs is pregnancy. Obstetric is pregnancy and childbirth. Good follow up of women that are pregnant until birth of the children, until they are good. You see, that is called obstetric uh, follow up of pregnancy. And then we have something else called gynecology. Diseases of female reproductive system. Female reproductive system. Hmm? Now, let me ask, if gynecology is which check, is a doctor of female reproductive system, what is the name of uh, Sorry. Sorry. Reproductive. Yes. You see, people ask me, doctor, the person who deals with female reproductive system is a gynecologist. But who is the person who deals with the male reproductive system? You see, in reproductive system of a male reproductive system, a person who deals with male reproductive system is called a urologist specialist, a urologist, knows as a urologist. So we have a gynecologist who deal with women, but we have another person here who is a urologist who deal with men. And you know, why is this person called a urologist? This person is called a urologist because of one thing. Is this person in a male reproductive system? We have something called the testes, we have the penis, we have the prostate glands, we have the vas deferens seminal vesicles. They treat conditions such as erectile dysfunction, prostate cancers, male infertility, benign prostate hyperplasia. These are conditions that affect men. And you see, these conditions are at the level of the bladder, from the bladder to the penis. So most of them, they can, let's say, if a person gets benign prostate cancer, hypertrophy, there is a difference between hypertrophy and hyperplasia. If a person gets that, it will block the urethra. It will block the urethra, and this person will not be able to go to urinate well. And that's why it is important for a man, when this man has a problem, it is important this man to see a urologist, not a gynecologist. A gynecologist is a special person that deals with gyne problems, diseases of female reproductive system. When you take your wife to a gynecologist, you are there as a man to be a cofactor, to be a cofactor. But when we feel that you person has a problem when it comes to urinating, you person has a problem when it comes to ejaculation, infertility issues, you are not going to urinate well, we will take you to a special person who is called a urologist. You get it? A urologist will do his work well by doing some tests, some ultrasounds. He'll do some, when it comes to cancer, we do something called FNF, fine needle aspiration, so that you can take the sample to the lab and know why this prostate is swelling. Why is this prostate becoming bigger, 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 and it's causing mayhem? This person cannot go to urinate. You get it? A urologist. There is a person called andrology specialist. Andrology specialist, when it comes to these factors, focuses only on male reproductive health and fertility. This is a branch of medicine that is called andrology specialism. Andrology, androgist. We are talking about tissues of androgen, andrologist, male reproductive order. But we see there is another person who is called endocrinologist. Endocrinologist. Endocrinology treats hormone problem affecting male product. So the person, when it comes to male reproductive system and the male problems, when it comes to male reproductive system and male product problems, what do we feel? We get this person that is called the andrologist, We get the urologist. I've explained why. We get the andrologist that deals with fertility issues. So our men, our men, our men, when you have problems of down there, when you have problems down there, I don't want to find you going to seek advice from gynecologists. Gynecologists, we have said, gynecologists are doctors that deal with women's affairs, women affairs. As a man, find a urologist. As a man, find a gynecologist. As a man, not a gynecologist, an endocrinologist. You get it? For your hormonal issues to be sorted. But when it is fertility issues, let's go and look for an andrologist. You see, so we are learning so much about the health system. Now we are in the hospital. We are in the hospital, and then here we see we have talked about the obstetric and gynecologist issues. Obstetric and gynecologist issues. Obstetric and gynecology, that is for women. Surgery. There is a branch of medicine in hospital that is dealing with surgery issues, surgical issues, and these surgical issues, treatment of diseases or injury through operative procedures. Operative procedures. There are some problems when you get to hospital. They can, we can just, we need just to go inside. We need just to go inside and get to see the problem so that we can remove or recorrect. We can remove, reduce, or recorrect. Those are surgical issues. Those are really surgical issues that we can recorrect or redo. And then we have psychiatry. Psychiatry. Psychiatry is a branch of medicine that has a problem because there are some branches of there are some places in hospital when a person goes to hospital and then you tell this person, please, we want to send you to the psychiatry department so that you can be checked by the doctor there. It becomes a problem. It becomes a big problem, my friend, because so many people, when you tell them, please go to the psych department to be checked by a specialist, the first thing they think about is the doctor has told me that I'm psych, I'm not okay, and I need to be checked if I'm a mad person. No, the psych department is a very big department in a hospital. Is a branch of medicine that deals with mental health. Mental health, mental. When we talk about mental health, we are talking about the brain and the cognitive functions, the functions that you yourself balances within your IQ, intellectual quotient. You get it? So let's see. A doctor in a field of psychiatry, they diagnose, treat, and prevent mental, emotional, and behavioral disorders. Behaviors. So if there are so many behaviors that people have, that it can cause them to go to the mental department. One of the behaviors is what? One of the behaviors is lying, cheating. Cheating. Cheating has become normal. That is a bad behavior. Okay. There are conditions such as depression, schizophrenia. There are conditions like bipolar disorders. These are things we have talked about before. We are just talking about the branches. Anxiety disorders. You are always anxious, and then you go to a hospital when you are sweating. Your BP is high. They take your BPs, a doctor diagnoses you, tells you you are in the wrong department, my friend. I'm sending you to the psych department, room number 5. And then you start shouting to the doctor, I'm not mad, I'm okay. Let's learn, my friends. If you are taken to a unit, like here in Kenya, we have a big hospital called Madari, where every person thinks people that go there are mad people. No, it's a big no. You've seen there are some people who have schizophrenia, there are some people who have bipolar disorders, there are people who have obsessive compulsive disorders. They can't move on from relationships. Hmm? They can't move on from attachments for some things. It is called obsessive compulsive disorders. Yeah? These people cannot move on. They'll always be attached. It's a complication. And you see, being attached to something and it's not going well, it can lead you to have a problem. And that problems need you to be sent to a place like a psych department, or different place that you have a person who is talking to you. Yeah? If you have a, a question about it, please ask. Today, I just want questions, and then we respond, all of us. And then there is substance use disorder, addictive to substances, addiction to substances, and substances we call drugs and alcohol. And when we talk about drugs and alcohol, my friends, I'm not talking about the drugs in the outside there that are being abused. Even hospital drugs plus over-the-counter drugs, they can be abused. So when a person is abusing marijuana or cocaine or so, there are some drugs in the hospital that can be abused. There are so many, the drugs that are prescribed, prescription drugs, including painkillers. There are some painkillers that contain codeine. They can be abused. So when I'm talking drugs and drugs and substances and alcohol, I'm not just saying those drugs that you think, the cocaine, the what. I'm talking about the real drug, or everything that is called a drug. Everything that is called a drug, you need to go to this hospital, of psychiatric department in a hospital, so that you get the specialist to help you move on. What psychiatrists do in a hospital, they assess mental health conditions. They assess mental health conditions. They prescribe medication. They prescribe medication. They provide psychotherapy, talk therapy. You know, talking is something. Let me tell you one thing in life. When you are indoors feeling relaxed and you think that everything is okay, you are doing harm to yourself. There is a problem nowadays of something that people have embraced. So many people, you'll ask them, hi, how are you doing? They'll tell you, I'm fine. And you know, I'm always an introvert. Introvert, they take it as a person who stays at home, indoors, doing nothing, watching or just going through the phone. This person has a character disorder that is attached to it. Kwa hivyo, so you'll find it is obsession of that word introvert, making this person suffer from himself, inside himself. Imagine. Hmm? So let's not misuse words. Let's get help. Psychotherapists, they help you get away from this. I've seen so many people that stay indoors, they think everything is okay financially, they are stable, but you'll find these people have hypertension because they are really thinking deep and they are isolated. Their brain is always working hard, using a lot of calories. As they say they are relaxed, they are having a problem when they are indoors. So let's not misuse words. Let's visit this site. Let's embrace mental health. Let's embrace mental health. Let's make mental health a good thing. But I've said, even you being a liar, people that lie to people every time, they need help. So let's talk to our politicians. Now we continue with branches of medicine. We have talked about psychiatry. We have talked about it. So we when you go to a hospital one day with a person or you yourself or a relative, and then this relative is sent to the psych department, please don't shout to the doctor. The doctors have good tools in their brain. They have studied for so many years to know how to diagnose a person who is undergoing these problems. Yeah. Ask the doctor, why are you sending me there? The doctor will explain, and then everything will be okay. If you are written some drugs and then you feel these drugs, they are meant for psych issues, please ask the doctor why and how this the diagnosis was everything he has talked to you and written down and asked the question has led the doctor to getting a diagnosis of you getting to a psych department. Don't just shout. It is very important because it's helping you. Okay, let's go to dermatology. The skin. Derma means the skin. Dermatology means the skin. It deals with what? The skin has hair, and the nail diseases. Yes. Remember, the skin has several layers. Your skin that you see has more than several layers. So let's look and see what does the dermatologist do. Today I'm talking about this topic because someone, a very good friend of mine, called me a herbalist. A very good friend of mine called me a herbalist because I was talking about complementary medicine and alternative medicine. I will explain when we reach there. Now, dermatology is the branch of medicine that deals with skin, hair, and the nails. And the specialist in this region is called dermatologist. Dermatologist. You get it? So, dermatologists diagnose and treat conditions such as eczema, acne, psoriasis, the skin cancers, fungal infection, and vitiligo. Vitiligo, you understand there, the loss of color of your skin. When your skin has no color, when your skin has no color, you don't know if today, oh, I'm not using that software. I could show you the pictures of vitiligo. Vitiligo. So they examine the skin, treat infections and rashes, remove skin growth and lesions, some lesions that are in your skin, and manage hair and nail disorders. When you have problems, fungus that are eating your nails, you go to a dermatologist. A dermatologist is a very good person that likes people to look good. He likes people to feel soft skin. He likes people to be always having good nails that are all auspicious. When you look at that person, you feel, wow, that one is a good person. So if you have all these fungus problems, the skin problems, the hair problem, the nail problem, please go to a dermatologist, and then we go to a person who is very special, a person who focuses and wants us to check and wants us to know that everything is okay when we are seeing. Yeah? This is a person called an ophthalmologist. An ophthalmologist. An ophthalmologist is a person who makes sure that we are okay and we see Mercy Grace, you on Daktari. Wow. Mercy Grace, I'm explaining to people different specialties in medicine. Different specialties in medicine. I'm at night shift and I've taken this time at least to talk to my people. You see, now we have a person who called, and I want to explain the difference between an ophthalmologist and an optician. People confuse who is an ophthalmologist and who is an optician. Let me say this first. An ophthalmologist is a branch of medicine that deals with eye and vision, look, how you look, and how you see. Hmm? This one is a special person that deals with cataract, glaucoma, conjunctivitis, myopia. You know, myopia is people that have short-sightedness, and hyperopia, people that have long-sightedness. This is the work of an ophthalmologist. An ophthalmologist is that special person in life that wants people to see well, wants people to see far, not to have problems with the eyes. They examine and test vision, they diagnose the eye disease, prescribe glasses for glasses or medication. You get it? They describe glasses or medication. Perform eye surgery. So an ophthalmologist is that person that performs eye surgery. And then we have someone called simple definition when it comes to ophthalmologists, a medical specialist that studies and treats eye and vision. So we have to ask ourselves the difference with an optician. The difference with an optician. What is the difference with an optician? The difference between an ophthalmology specialist and an optician is mainly in the training and their work. Yeah, how they are trained. Ophthalmologist, a medical doctor who specializes in eye diseases and surgery. You understand? Works in the field of ophthalmology. Works in the field of ophthalmology. Can diagnose, treat eye diseases. They can diagnose, treat eye diseases. Prescribe medicine, which is normal. Perform eye surgeries, you see, which is normal. Treat conditions like cataracts and glaucoma. Now, opticians are trained technicians. So, opticians are technicians, not a medical doctor. Their main work is making, fitting eyeglasses and contact lenses. These are called opticians. Optic means the eye. Optic nerve, the eye. Now, intercepting prescriptions from eye doctors, interpreting the prescriptions from, they interpret prescriptions from ophthalmologists, adjust the frames for patients. When patients are, you think your frames are so uh, they are not adjusted well, they are, you're not having the good vision an optician can do. So let's see, training of a ophthalmologist, that is a medical doctor. Optician is a technical training. Technical training, we call them diplomas in Kenya. Diplomas. Diagnose diseases, yes, they can diagnose, but you see, an optician does not diagnose. That one is a person who just takes the prescriptions, sees how he can fit your glasses, and give you the drugs that are from ophthalmologists. And then we have prescribed medication. Who prescribes medication? An ophthalmologist. An optician only interprets and does what an ophthalmologist has said on prescription. They perform eye surgeries. They perform eye surgeries. These are the ophthalmologists, and opticians don't perform eye surgeries. You see, opticians don't perform eye surgeries. Make fit glasses. Sometimes ophthalmologists can, but you see, that is the work of technicians with an optician. An optician. Now we continue to the next specialist. The next specialist, today I'm talking about the branches of medicine. The next specialist is called otolaryngology. Otto, Otto, ENT, ear, nose, and throat. Otto, that one I'm peeling it. That one is a very, some people even cannot spell that word. Ontorology. Ontolaryngeology. Ontorology treats conditions of the ear, nose, and throat. So when you are sent to an ENT, that is the special person. And then we have cardiology concerning the disease of heart and blood vessels. Diseases of heart and blood vessels. This one is a person who treats the heart and blood vessels, and not the heart when you are heartbroken with your partner or emotions. When you have issues with your partner, you are heartbroken and you have problems, I will take you to the psych department, I'll take you to your pastor, but here we are talking about physical heart issues. Physical heart issues. Let me go back a bit to an otolaryngology wizard, an ENT, a person who deals with ENT, ear, nose, and throat. An ENT deals with otitis media, the middle ear infection, sinusitis. You know, people, my son, those ones are very hard. I know how opticians, those O's, yes, Mercy Grace, sometimes those words are hard. Those words are hard. Now, when we talk about, when we are talking about something called uh, sinus is a normal word. Everyone has sinus. In simple term, tell you, sinus is a shimo. It is a hole. In Kenya, we talk in Kiswahili shimo, a hole that helps something to pass through. So we have sinus here, the hole. That's all. So when it is inflamed with the cartilage, we call it sinusitis. So sinusitis is the problem. This is a special area to ENT department, people with problems with ENT. Hearing losses, people who have problems with hearing losses, and then allergic rhinitis. You're just having problems, running nose always, running nose always. That one is especially to an ENT, otoradiology. Now, we continue and talk about something called cardiology. We have said neurology, a person who is a neurologist. Who is a neurologist? We are talking about branches of medicine. Branches of medicine. Neurology is a person who deals with neuro. Anytime you feel you listen to a word called neuro means nervous system. The brain, the spinal cord, nerves, muscle related to nerve function. Those are the work of a neurosurgeon is a surgeon who deals with nerves and muscles. Now, they treat diseases like stroke, epilepsy, Parkinsonism. These are diseases that are related to your head and brain. Migraines, multiple sclerosis. Multiple sclerosis are the conditions that are related to your brain. What neurologists do, they examine your nervous system, the brain, and the nervous disorders. Other other tests like brain scans, the MRIs, the CT scans, those ones are the work of a neurologist. Now, there are some areas where we talk, and it reminds me we are in the topic called GIT, gastrointestinal diseases. This is a person who has studied something called gastrology, gastroenterology. Gastroenterology is a branch of medicine that deals with it deals with your this is a branch of medicine that deals with your what? Stomach issues, the digestive system. And as we introduced the digestive system today, you've seen how the digestive system is a big system. You've seen it. And we just introduced it today, and you've seen how many things are related to the digestive system. So the topic will continue even tomorrow. But right now, you see, just passing through some issues that people need to understand and know. There is something called the organs that are related to this specialty: the esophagus, the stomach, the small intestines, the large intestines, the liver, the pancreas, and the gallbladder. Yeah, related to this specialty. This is a person who knows well about the gallbladder, the pancreas, the liver, the large intestine, the small intestine, the stomach, esophagus. You get it. And they treat diseases like the gastritis, peptic ulcer disease. I will not go deep into this because it's the topic that is continuing. Endocrinology, my friend, we are still far. We are at the 12th specialty, which is dealing with endocrinology, hormones, endocrine. Endocrine means hormone. Hormones are endocrinologists. Hmm? A doctor who has specialized in endocrinology is a branch of medicine, is a person who deals with hormones and endocrine glands. Those glands that release hormones, this is a person that deals with them. And he knows well how, there are glands like the thyroid gland, the parathyroid gland, the pituitary gland, all those. Now, if you are having a problem with that, you have been diagnosed, you will be sent to an endocrinologist. An endocrinologist will look at you and look at well what is disturbing you, and you will be diagonized. There is a pituitary gland, the thyroid gland, the parathyroid gland, the adrenal gland, the pancreas is a gland. Yes, and ovaries and testes, and ovaries and testes. All this will be part of this person's endocrinologist. And you see, when we're talking about endocrine glands, these are things that control some things like sugars, like it's very many things like the cortisol that are released in your body. So they treat what? They treat diseases like diabetes mellitus, hyperthyroidism, hypothyroidism, Cushing syndromes, and Addison disease because of the cortisol. You see, so when you are having diabetes like and hyperthyroidism, you will be sent to a doctor called the endocrinologist. This one is a branch of medicine that we will talk about because of its specialty when it comes to glands, and you cannot survive well without glands. So we go to another branch of medicine called orthopedics. Orthopedics, I know this one, people know it very well. Orthopedics is a branch of medicine that deals with bones, joints, muscles, and fractures, and they will help you when you have a fracture to revive your bone and heal. We will talk one day about bone healing. Today, people think when you're going to a hospital, it's only when you are very sick and you want to be okay, so you go to be given medicine. That's why I'm going through all this these things that you're hearing here, like orthopedics, like you see, it's a very vast industry, and every person has got his or her specialty. That's why when you go to Dr. 1 will write a referral to Dr. 2 because Dr. 2 knows better than what one. You get it? Now we have public health and community medicine. Public health and community medicine in hospitals. There are these people that are trained and they know good about the public health. See, sanitation, people that know how to prevent diseases, people that know health promotion, good health, not bad health, and population health. You have heard about statistic, epidemiology. Those are these people of public health are trained of. It's a branch of medicine that focuses on health population rather than individual patient. Not you alone, but a population. So you see, being a doctor has got many branches. A doctor in this field of public health, a physician or community health, what does this person do? Because this is a doctor who is not really just treating people, but listen, this person deals with the disease prevention, health promotion, epidemiology, study of diseases pattern and population, epidemiology. Because if you don't study diseases pattern, what will happen? You will find a very vast place is about to go wild. You remember how COVID came, even cholera outbreaks. Now, these are the people who steps in, does their work so well. We have environmental health, the environment, sanitation. Yes, health policy and management. Health policy and management, nutrition and sanitation programs. These are the people who do them. And after the gastrointestinal issues, we will go to public health. We will go to public health and we sanitize. We sanitize our environments. Some works in this profession of public health as a doctor They check on immunization programs like polio, measles vaccination, and the normal children vaccination programs in hospital. They follow up to get to know that this one is done correctly. And if it is done correctly, there is no way we can have problems in this, because they can bring future problems if immunizations are not done. Monitoring and controlling outbreaks like COVID, cholera, and dysentery. This is their work. Promoting health lifestyles, smoking campaigns. You understand? Alcohol drinking, sanity in social life. Conducting community health researches to find a problem and get rid of it. Designing public health policies. So when you come to public social health policies, this is the doctors who come down and they define the policies. Now we go on to something called emergency medicine. Emergency medicine is a very broad medicine. If emergency medicine is not there, some diseases will destroy people right, left, and center. Some diseases will destroy people right, left, and center. Is a physician who is like a soldier. When something comes out, he's right there with the tools and wants to destroy that thing that is coming to kill the human life. Emergency medicine is a branch of medicine that deals with life-threatening conditions like heart attacks, trauma, and strokes. They come and save the situation faster. Acute injuries like fractures and burns and wounds. You see, those ones. There is a burn somewhere, a building is burning, there there is an emergency, they come and save those people. Certain illnesses like severe heart attacks, seizures, and allergic issues, you have taken some food or alcohol and you are dying. They come faster to stabilize you before you go to hospital. Stabilization and rapid decision making. They assess and triage patients quickly. This is their work. Provide immediate treatment to life to save life and prevent serious complications. You see, coordinate care with specialists if needed. Perform emergency procedures like CPR. CPR is ABC, reviving the patient, intubation, and wound management. You get it? We are continuing. We still have like 3 specialisms. Radiology. Radiology is when you are sent to take an image of your chest, you are coughing a lot, and then you are being told we need an X-ray of your chest. You go with a prescription to another department. You find there a very serious madam. You find there a very serious gentleman in a white coat or a blue like mine, asking you, yes, give me your prescription. You give, and then it gives you another. You remove your clothes. It tells you now you will stay there. We want an X-ray. An X-ray. This is a specialist called a radiologist. They do X-rays, they do CT scans, they do MRIs, ultrasound, and mammogram. So that when a doctor has the X-ray, he'll know this is a fracture of a specific place and it needs to be treated like this. This is a very special doctor. He is in the department of diagnostic department, the department that deals with the diagnosis, the department that deals with getting to know your problem before faster so that you can get the real treatment. So the laboratory is another place, but the radiology is another place again where you really need to be there to find out. So diagnostic department, that one is the last thing that I'll talk about here after we talk about family medicine. But there is another place we call pathology. Pathogens. Pathogens are things that are bad. Pathogens are things that bring diseases. So when you talk about pathology, pathology is a branch of medicine that deals with studies that cause nature and effect of diseases, examining body fluids and organs in your body. A doctor in the field is called a pathologist. So in pathology, my friends, as you're listening, in pathology, What are we talking about in pathology? In pathology, we are talking about histopathology. Histo means tissues, like your thyroid tissue. You get it? Your pancreas. This is the person who goes and do microscopy. They do fine needle aspiration to find out what is the problem. Histo, the tissues. Cytology, they study the cells. So cytology, they study the cells to get to know why are these cells multiplying like this. This is pathology. Clinical pathology, laboratory medicine. They examine, analyze urine and other blood fluids. You get it? Very important, and it is very important when it comes to the studies of cancers, a pathologist. Yes, there is something called forensic pathology, determining the cause of death in illegal cases. When a person dies and you go and request for an autopsy, there is this guy who is very serious. This guy or this lady who smiles every time, very humble, but he's a doctor who is called a pathologist. Yes, Kingre, welcome to the platform. We are talking about branches of medicine, and everyone who is watching, please follow Kingre, like her videos. She's a nice lady. She likes smiling every time. She's a humble one. If you like her videos, we'll always smile and feel nice. The Kingre, welcome to the platform. Don't forget Mercy Grace. They are always smiling ladies. Their platform is full of smiles. Yes, let's continue I've said forensic pathologists. When someone has died and you have asked for an autopsy, this is that person that will come there, do his thing, do the cadaver, the dead body. He'll go inside there and do his thing, and he'll find the cause of death of this person. So let's respect the forensic pathologists and the pathologists at large. We have the last one that deals with family medicine. Family medicine. You see how many doctors we have talked about? Medicine is a wild field, my friend. Medicine is a wild field, and we have talked about so many things. Smile, greetings, doctor. Smile in the city. Smile in the city. Welcome to the platform. We are talking about branches of medicine. People are confused. There is someone who called me a herbalist today, and I felt it is good I talk about branches of medicine. So we are at the family medicine. Family medicine is an important branch of medicine. These are doctors that are trained, that provide comprehensive and continuous health care for individuals and family across all ages, genders, and diseases. This is family medicine. A doctor in this field is called a family physician. Do we have everyone who is listening to me right now? By the way, if anyone has a question, let me not just talk. It's a random question. Please ask me a question that you like me to answer you as we continue. You can just post it there. Now, sometimes ago, we used to have family medicine, family doctors. That these people, these family doctors, what do they do? They talk about preventive care. They talk about, sorry, let's see, the light is going down. Let me enhance it. The light is going down. Let me enhance it. Yes, like that. Now, the family doctor, what the family doctor does, family medicine covers preventive medicine, preventive care, chronic diseases management, acute illness care, infections and injuries. You get it? Now, the family doctor will deal with your diabetic patients in the house, hypertension and asthmatic patient, because this is a chronic condition. It's not ending today. You get it? And there is another one called health education and counseling. Maybe you have a problem in your house and you don't know how to go about it. Your family doctor or the family physician will talk to you and he'll explain how you are supposed to do it. Coordination and care, referring to specialists when needed. You get it? Coordination and care. Now, that is the family doctor that comes in. Then we have a specialist, a very nice, important specialist, a branch of medicine that is called diagnostic diagnostic medicine. Diagnostic medicine. Let me tell you, I will repeat and I repeat again. It's not just getting into a hospital. Now everyone understands. It's not just getting into a hospital and seeing anyone. The person you are seeing there first is called the diagnostic, the diagnostic doctor. Now, we have talked about very many things. One, let me tell you the branches as we go on. If you have a random questions that you have anyone, don't fear. Ask me any random medical question we discuss. I have 30 minutes. Today I have a lot of time. I'm at night shift and I have a lot of time. So if you feel you have a question, let's discuss, let's talk about it. Now, internal medicine, it deals with the diagnostic and treatment of adult diseases. Now, we have talked about pediatrics, the pediatricians, we have talked about obstetric and gynecologists, but we have talked about another one who treats men, who is an we have said a doctor who treats issues of men reproductive diseases is called a urologist. It's called a urologist. So as women have their gynecologist, men have their urologist. And there is a special one who is called an androgist. Androgist deals with androgens, and these androgens they are the specialty that treats men. Now we continue to another branch we have talked about with surgery, psychiatry. We have talked about psychiatry. We have talked about dermatology. I'm still asking anyone who has a question, just put it. I'll answer you. Today is random talk. Ophthalmology, we have talked about it, and we have talked about the difference between ophthalmology and opticians. Opticians are technicians, ophthalmologists are the doctors. We have talked about it. Otolaryngology. Otolaryngology is a doctor of ENT, ear, nose, and throat. Some people just say, I've been sent to an ENT, and they don't know who they have been sent to. You have been sent to an otolaryngologist. Otolaryngologist. There is a person called a cardiologist. A cardiologist is a person who deals with heart diseases, conditions of the heart. Condition of the heart, we have talked about it. There is another person called a neurologist, a person who deals with the brain and the spinal cord disorders. Please, you go through the video. If you are just coming in, listen correctly. Gastroenterologist, a person who deals with the stomach issues of the stomach. Yeah. Issues when it comes to your mouth, your small intestines, your stomach, your large intestine. You go to a gastroenterologist. Endocrinologist deals with diabetes, hormones, people with diabetes, and orthopedic, we know, is bones. Public health, we have talked about that. Special doctor who does not just treat one person, but treats a multitude of people. Emergency medicine, that one is a very broad medical part. Emergency medicine, people who deal with emergency medicine, they are life-saving people. We have talked, you can, if you are a doctor, or you can specialize in a course called ATLS. It is called an emergency medicine program that you can go, and then you join these people called emergency medics. We have radiology, a person who is in the radiology department, X-rays, CT scans, MRIs, and all those to diagnose someone. Pathology, we have talked about it. Family medicine, that was the last one, but there is a special one. Hey, Kingre, they have unhung the electricity because of rain. Will watch. In Kenya, when rain comes in, electricity goes away. Very bad. Now we have a special unit here called the diagnostic medicine. This is the last one. I am over 1 hour. I am at 1 hour right now. As I finish it, Diagnostic medicine is a branch of medicine that focuses on identifying diseases using tests, imaging, and lab analysis. So these are pathologists, radiologists, clinical laboratory scientists perform lab tests like the liver function test. We will talk about lab tests tomorrow at night if we find time, but at 4 tomorrow, we are continuing with our issues of the stomach. We are continuing with the issues of the stomach tomorrow. So if you have a problem that has been facing you of the stomach, please tomorrow at 16:30 Kenyan time, Kenyan time. Be there to listen about issues of the stomach and how you can handle your stomach well. Yes. Now, this the diagnostic medicine, they perform laboratory studies like blood, urine, and tissue analysis. And then there is imaging diagnosis like X-ray, CT, and MRI and ultrasound. We have functional tests like ECG, EEG, pulmonary function tests. These ones are the diagnostic tools. You see, they confirm diseases. So anyone who has a question, I've waited for a question. No one is asking any question. People are just watching and listening to the doctor. Please don't just listen to doctors. Ask these doctors questions. Why are you giving me this injection? Why? If that doctor goes mad, tell the doctor, then don't give me the medication. Let me go to a doctor can explain to me why and why I need that in my body. Hmm? So please, people, it is very important when you go to a hospital, you are there, you have your doctor, and this doctor is telling you, please go and go and do this laboratory test. Ask the doctor why. The doctor will tell you, because I'm suspecting A, B, and C. If you are given a medication, they are just those doctors that you enter to the doctor's office. That doctor has a pen and a paper. He asks you question as he looks at you like this with some spectacles. Right. Yes. Do you have fevers? Yes. Do you have this? Yes. When you ask a doctor a question, he looks at you like this or she looks at you like this and continue writing. If you have a right, you have a right to know what is going on to your body. Even if the queue outside there is too long, ask questions, but let's ask sensible questions. Doctors are human beings too, and they need to be treated as human beings. There are some mistakes doctors do, and people go mad about them, and this doctor was saving a life. So good people that are listening to me, you don't want to ask me any question, or you just want to listen to Benjamin, the wise guy, Dr. Ben. Here they call me Dr. Ben. You want to listen to me and feel nice. Make me laugh a bit. Anyone who has a question, please. Any question, any random question. Give me any random question. Let's talk it before I go. I have 10 minutes, 20 minutes. Any question? Any question? As tomorrow we wait for our diseases of the stomach. Tomorrow, as we wait for the diseases of the stomach. What is the most, you are so right about that. Yeah, you see, smile in the city is attesting. You go to a hospital, you find a doctor there. The doctor looks at you like this. You are asking question, he looks at you, he continue writing. What if you are being given water for injection and not treatment? What if you are given a poison? It's not good to be like that. Ask doctors question. You are a layman, he's trained. He's supposed to give you the step-by-step management so that you know. If you have stomach issues, you really need to know you have stomach issues. And let me ask, have you ever gone to a hospital and then come out so sick, more sicker than you have ever gone to the hospital? There are some people who go to hospital and they come out of hospital more sicker, more sick than even how they went to hospital. Have you ever been in that situation? Why? Hmm? There are several things that you see when you go to a hospital or a doctor's office, you are having a problem. and you have that problem, you need that problem to be sorted. Let me write these things here first. So some people go to hospital to find help, but they come out of hospital when they are more sick. Let me talk about that before I go. Before I go, situations. Wait a bit. I fix this. I'm seeing my net can like go down. Go just a minute. Now, that is a very funny thing, and it's very important we talk about it. Have you ever gone to a hospital and then you come out of hospital more sicker than you went in? Yeah? You can go to a hospital with a disease, you are admitted, and then you catch an infection there because many people are in one ward, or the surrounding you are having people. So you can get something called MRSA, multi-resistant uh, strains infection. You see, pneumonia, because you've gone with this disease, but a person is coughing there, and that person is giving you another disease. You see, and then these are being brought by poor hygiene. Maybe for ladies, you go to a hospital and you're pressed, and you go to the loo there, and then you get UTI, and it becomes more bad than what you went in with. So these are things, hygiene, that we need to seek. You go to a hospital, and the medical errors happen in hospitals, and they are not good. When you go to a hospital and you get medical errors like mistakes during diagnosis, treatment, or surgeries, wrong medication or dosages, these are things that we have gone and seen in hospitals. It is, I tell students that you are dealing with human beings, and please check your documentation before you give it to the pharmacy. It is, you can kill a person thinking you are treating a person. Surgical errors in the operating room. If you are not sure about it, wait. Come to the surgical department when, if you are a doctor and listening to me, when you are upright here and you are not having social issues that you've come with at home to the operating room. You can kill someone further. You can kill someone's child. Yes? Misdiagnosis leading to delayed or harmful treatment. Someone has come to the hospital with headache because he has gastrointestinal issues in the stomach, because now you think you know so much, you tell this person, no, this one is just acidity, take omeprazole. And this is a person who has issues concerning calcium issues. And omeprazoles, they are called PPIs. Eh? They make your bone to be more problematic. You give this person long-term omeprazoles, you give this term antacids for long-term, and this person is a person who has genetic problems with calcium. The bones become brittle. You'll make this person never to walk again. Misdiagnosis. You go to hospital and come out very, very sick. Very bad. Very bad for health professionals that don't go for SMEs. Those health professionals that only go to work to get money. Those health professionals that only want to drink and wake up to go to work. Study hard. You are dealing with people, and you are not dealing with computers that are machines that you can just change apart. Please listen to me. It is so sad. If you are a medic, let's reason out, let's study, let's research, let's go on updating our skills to help our people. You see, now, antibiotic overuse and resistance. Antibiotic overuse and resistance. You are using a lot of antibiotics. Every time you have an infection, a urinary tract infection, you have an infection, you are using amoxicillin. Amoxicillin amoxicillin is a drug called a penicillin. You'll get resistance for a penicillin, and then you'll have to go to search for a drug that will help you. You're wrong. Every time you go to a specific doctor, because he's your doctor or she's your doctor, you know this doctor so well, you trust this doctor. That for me, let me tell you one thing about me. If I treat a patient and this patient likes my treatment, I tell this person, as I treat you, find another, you go and ask, find another opinion from another doctor. So that you can be confident that what Dr. Ben is telling me is the right thing. An opinion is not overruling your work. An opinion is saying that I'm just finding out, maybe Dr. Ben, you see, and I feel so good when they come and tell me I was advised by this doctor about ABCD. Now I might have forgotten something, but I told this person, no, we can do this, and this, or if this person is right, we can do that. You get it? That is a learning situation. If a medicine has no stop, you will learn and learn and learn forever. Now, antibiotics resistance is a very bad thing. Imagine a person with a resistance with anti-TBs and having a strain of TB that is resistant to those drugs. Which other drug will you treat this person with? My friend, you will move on killing people with your resistance. So we don't want resistance of anti-TBs. And please, if you are watching and you can share this to a person who loves drugs, share this video. No, we have delayed and inappropriate treatment. Late presentation or delayed in hospital can cause worse. Please, we have talked about doctors a lot. When you see there is something that is disturbing you, you are using the herbs at home and concoctions, and it's not working, please rush to hospital. Please rush to hospital. You may bring problems to yourself. You may bring problems to yourself. So let's get in time in hospitals. Don't use means to treat ourselves as the population out there. Waiting too long in the ER for heart attack. A person has gone to hospital, has an heart attack, you are still giving milk at home. No, you have to take this person to hospital. It can cause a death. It can cause permanent damage like strokes that people cannot walk well. These are issues that makes people go to hospitals and come out so sicker, because you have just taken your person well to hospital at the right time, and then there is a delay. There is a delay in people walking around. Slay queens who are nurses, slay queens who are doctors, they take time. Even slay kings, not even slay queens only, even slay kings, men that just take their work slowly. They don't want to, what, how do I say, take your professional work very serious. Let's go and slay at home and out there, not in the workplace. So these are things that make people go to hospital and come out so sick. Delayed inappropriate treatment. You are delaying treatment of someone, that someone is getting a heart attack. Post-surgical complication like bleeding or hematoma, blood clots, infection, and surgical sites, they cause problems. And then we have medication side effects. You can take some medications. When you take these medications, they bring so many bad side effects. They bring so many bad effects than the disease that you had. Certain painkillers can affect kidneys or liver, or chemotherapy can weaken immunity. You see some medications like painkillers like diclofenac that people love taking when they're feeling pain. You should be very careful. I know everyone knows diclofenac, NSAID, and Brufen. Those are NSAIDs. They may do bad things to your liver and kidneys. Please seek prescriptions before you start taking several drugs like painkillers. Immunocompromised patients, people like with weak immunity like HIV and cancers, get worse infections when they are in hospital. Hospital acquired pneumonias. This is a person that the cancer has weakened his immune or her immune system or HIV, and then you are keeping this person in hospital in a very dirty environment around so many people, with wards that have so many people, wards that have people more than 10 squeezed. What do you want? You want this person to get a MRSA, a resistant strain, pneumonia, and his immunities. These are things that make people go to hospital and they come out so sick, and even they come out as bodies or as people. Eh? Mental health deterioration. Hospitalization can cause stress. You have noticed sometime when you have old people and you tell them I will admit you because of this person refuses, because when they are inside there they feel so stressed, they are stigmatized, anxiety, depression. So you should vary about admission. Don't just admit. You know, there are so many hospitals that admit to get money. You are admitting patients to get money and you are not taking care of their mental state. My friend, yeah, the God who is above is watching you as a medical practitioner, as a CEO, as a clinical officer, as a nurse or a health practitioner who is admitting a person like this. Follow the principles of medicine. Don't let people go to hospitals and they come out so sick. Don't. It is bad. It is unethical. Follow the principles of medicine. You see things like this: poor infection control. The doctors who are public health controllers taking salaries and staying at home don't go to work because they think they don't have work to do. And then when there is a strike like cholera around the hospital, before they realize, it is has done worse to the patients and they're being discharged to go home and spread it. What else do I need to say, my friends? My friends, what else do I need to say? Eh? Things that make the public come to hospital for help and then they go home so sick. What else do I need to say? Lack of follow-up. Patient discharged too early without proper guidance on medication. Eh? Because you don't have enough money to continue treatment and you need that space for another patient. And ethical. You see, we can talk and talk and talk and talk, but professional ethics are very important. And you will realize that here, I'm just talking about professional ethics, professionals being professionals. So the public needs to stand for their feet and ask questions. You see, I'm really talking and people are looking at me and they are really listening. Some are even shaking their heads and smiling, and some are listening and feeling bad. Please, that's why you are not asking me any question. No one has asked me any question, but it's okay. I'm just talking to my beautiful friends here. I usually tell my people, if you have a channel and you are listening to me, please post your channel link here. People will follow, or at the content. I was supposed to stop at 1 hour. I've gone up to 7 minutes now. Let's meet tomorrow. Today I'm at night shift and everything is night. It's raining outside so wild. Now let's meet tomorrow. I get some coffee. I keep warm. I see 1, 2, 3 patients. But we meet tomorrow at 16:30 Kenyan time. I don't know where you are, what time it will be. So people who are in Kenya, they know 16:30 is 4 o'clock in the evening. We meet tomorrow as we continue to talk about problems in our stomach. Problems from the mouth to the large, to the small intestine, to the stomach, to the anus, and you see, yes, and we continue. But if you have a specific question, always email me. So, people, bye. Meet tomorrow. Thanks for tuning in. Share. Everyone go to channel of J Kingre and support that smiling lady, a very nice lady. Even Mercy Grace, support her. Bye bye as we end the end stream. Remember, love always a good relation. Goodbye. See you. Let's meet tomorrow.